Chris Kelly here with you once again with EFT Tapping Solutions. Today we are going to discuss the topic of the fear of pain. So the first question you may have is, isn't the fear of pain natural? And the answer is yes. It's uncomfortable, we don't like it, so of course we don't want it and we're going to be afraid of it. So let me first give a little disclaimer here and say that obviously if you're in pain, you need to go see your doctor, okay? I want to get that out of the way. I'm not a doctor. I want you to go to the doctor and make sure everything's okay. The second part of that is I'm not discussing acute pain. You cut your finger, that's an issue. You have a severe injury, you need to go to the doctor. That's not the kind of pain I'm referring to. I'm talking about chronic pain. And this is pain that could last more than a couple days, a couple weeks, or a couple months in regards to whether your doctor says that this should be healed by now, or just if you don't go to the doctor, that you feel that you should be healed by now, but you're still compensating. And that's the next topic is usually when we're in pain, we compensate. We move in a different way. If you sprain your toe, your ankle, your knee, something like that, you're probably going to limp because you don't want to be in pain. So that's the next thing, and that's not good for your overall body. If you're limping, you're compensating, you're moving differently, and although the body loves to move, it puts different pressure on your joints on the other side of your body that you're compensating with, and that's never a good thing. So, especially on a long-term basis. So, let's get down to it in regards to fear of pain. And I'm going to give you a couple examples from some of my clients, some of my EFT tapping clients, and some of my medical massage clients, okay? I have clients that come in with knee replacements, hip replacements, rotator cuff surgery, all kinds of different things in regards to they've been to the doctor, they've seen the surgeon, they've been back to the doctor, they go to physical therapy, massage therapy, chiropractic, and they're still, their range of motion and their pain level every now and then isn't where it should be. And this is because usually you're afraid. You're afraid to move, and you're really not afraid to move. You're afraid that it's going to hurt. And this is a natural response. So that's what this tapping is about, is in regards to the fear of pain. And getting back to my clients, a lot of them, let's say you had a knee replacement surgery and you're a year out of surgery, you should be back to close to 100% normal, I would think. But a lot of people, they don't move their knees to the full range of motion and extend their leg. And this is usually based on fear of the pain. They've tried it a couple months ago, or they might have just tried it that morning getting out of bed, and it hurts. So, of course, you're not going to move it if it hurts. So what I want to do is just do some quick tapping on that. And what I want you to do is to focus on some of the issues of why you're afraid of the pain, or why that's kind of stuck in your psychological mind and up in your brain, okay? Again, you've got symptoms, which are the pain. You've got emotions. You might feel angry. You might feel sad that you can't do the things you wanted to do. You have events. You probably had the event that injured your knee or your shoulder or something like that. These are all areas you can tap on, okay? You want to tap on the symptoms. You want to tap on the emotions. You want to tap on the events when you injured it, or just this morning, let's say you're getting out of bed and that was a traumatic event because you re-injured your knee, or it hurts and you think you might have re-injured your knee. So that's a problem. And then you've got limiting beliefs. And that goes all the way back into your childhood of possibly when you injured yourself as a child, and now you're afraid to move or do certain things because you've got this belief that, well, I can't do this. I can't move this way. I can't go hiking because of my lower back, or things like that. So let's just do some real quick tapping on that. And this is where, you really need to put your thinking cap on to begin EFT tapping. So we're going to tap on the karate chop point. And again, if you don't know where to tap, I'm going to tap through the different points, but go watch my video where it says complete EFT tapping or complete EFT tapping protocol, and this shows you all the points to tap on, okay? So we're going to do our setup statement here. Your first is most pressing issue. So if you have knee replacement and you're afraid of the pain, say, I'm in fear of pain. So that's your most pressing issue. You're going to rank this on a scale of 0 to 10, and then you're going to do your setup statement. So we're going to do our setup statement, tapping on the karate chop point of, let's just pick something. Even though I'm afraid my pain in my knee is going to come back, I deeply and completely love and accept myself. I love and accept myself completely, even though I'm afraid that the pain is going to come back into my knee. I'm afraid of this pain in my knee, and that's why I'm not moving very well, but I deeply and completely love and accept myself. And then tap through the points. The inside of the eyebrow, I'm afraid of this pain. the inside of the outside of the eye, afraid of this pain. Under the eye, I'm afraid to move. Under the nose, I'm afraid to move and I don't like this pain. This pain might come back. I really don't want to move because I don't like to be in pain. I really don't want to be in pain. I'm afraid to move because every time I move my knee and extend it, I'm in a lot of pain. So you're going to just tap through all those sequences. And again, you have to tap through this multiple times, okay? And then extend your knee. Move your shoulder if you've had rotator cuff surgery. Move your lower back and see if you still have the pain. And then go ahead and scale that on the intensity level again. And then tap through this one more time. So one part of the setup statement I want to cover is in regards to when we say we accept ourselves and we love ourselves completely. If you listen to the internal dialogue that's rolling around in your head, a lot of times we're self-abusive. We're not very kind to ourselves. So I really want you to say that with intent, okay? I accept myself completely. I love myself completely, okay? If you want a great exercise that's a little enlightening, try and pay attention to the internal dialogue or the story that's always running around inside your mind. You'll be amazed at how often this turns negative and you get down on yourself. We get down on other people and other situations, but usually that's a reflection of how we feel about ourselves. So again, I want you to tap on in regards to the fear of movement, which is really the fear of pain if you've got chronic physical pain, okay? So what you can also do is just relax and move that area. Again, once with doctor permission, I don't want you, if you have a severely broken arm that happened yesterday, you're not going to be wanting to move it around, and neither is your doctor. But I'm talking about chronic issues that are months or years out that you're still compensating, you're still limping, you're still not raising your shoulder up to where you should be raising it. And those are the kind of issues that I'm really discussing in this video, okay? So I want you to put your thinking cap on. Think of the symptoms, which is the pain. You think of the emotions. Think of the events of when this happened. Tap on all of these. Tap on the last event that caused you pain and why you're still compensating. And then maybe look at some of the limiting beliefs of when you were a child, or maybe the limiting belief is what your doctor told you. Well, you'll never walk again. You'll never be able to raise your arm all the way up. Okay, that's a limiting belief that you believe, usually based on what your healthcare provider has told you. And as marvelous as these people are, they're not always correct. Okay, so I'm not trying to bash anybody or anything like that, but and this really isn't a miracle, but if you work on things, you should be able to get better. So that's a key point, and I want you to really work on these emotional issues. And that's, again, what EFT tapping is all about, is eliminating these negative emotions and working through all these unresolved emotions, okay? So again, we're just going to tap on this as, even though, my shoulder is not working properly and I don't lift my arm, I deeply and completely accept myself. I'm really in fear and I'm afraid to move my arm because it still hurts, but I love and accept myself completely. I love and accept myself completely, even though my shoulder may hurt if I move it. My shoulder may hurt when I move it. I'm afraid to move my shoulder. I'm afraid to move my shoulder. Every time I move my shoulder, it hurts. Every time I move my shoulder, it hurts. I'm afraid to move my shoulder. I'm afraid to move my shoulder. I'm afraid to move my shoulder. Okay? And then just go by what you're thinking in your head when you're tapping through these points. You'll have a lot of different things that come up. And maybe you're using pain as an excuse to not do anything, if you don't want to go to dinner with your friends or something like that. My shoulder's really hurting tonight. I can't do this. And that's a limiting belief. And that's, some of the consequences of getting better. It's not always consequences of pain. It's perhaps if you get better, well, now what do you have to do then? You have to go to work. You have to go pick up the kids from school. You have responsibilities that, if you're not feeling good, well, you can kind of get out of those. So take a look at this. Again, fear of pain. And not just pain itself. I'm going to be getting to those and spend a lot of time on tapping through actual pain. But I think the pain science video I created, this video on the fear of pain, of moving it, and just relaxing and trying to work through some of these issues will help you a tremendous amount. So I'm going to let you go for now. This video is getting a little long. Chris Kelly with EFT Tapping Solutions. I will talk to you tomorrow, and have a great day.